Hi, I'm Dr. Tanveer Janjua. I'm a board-certified facial plastic surgeon. Today I would like to talk about marginal mandibular nerve injury and its rehab. Marginal mandibular nerve is the terminal branch of the facial nerve that travels right underneath the jawline, comes up in this area and supplies the muscles that move our lower lip and the chin. This nerve in this path can get hurt during certain facial plastic procedures, including chin implant placement, submandibular gland removal, liposuction, or any injection or facelift in this area. There are two kinds of injuries that this nerve can suffer. One can be permanent, which is transection, or in other words, cutting of the nerve. That, if it happens during surgery, is permanent. If there's a stretch injury to the nerve from chin implant, liposuction, or some injections, that is more of a stretch injury or contusion of the marginal mandibular nerve. When that happens, it affects the lower lip in a way that when you smile and your lip is going up, then in certain smiles, this side does not go down. In other words, if this side has a nerve injury, that's the way the smile appears, because the other side muscle becomes almost hyperactive and can pull it down more during a regular smile. So when you smile, it will be which can be very distressing. When that happens, you can rehab the nerve and make it come back faster by having the patient do facial exercises like it looks very funny, very distressing, but at the same time it makes a difference. The more exercises they do, the better. But what works even faster is stimulating the nerve along its path using a nerve stimulator, and then making the patient do that 3 times a day, if possible, if not at least twice a day, 5 minutes each time, at a frequency level that they are amplitude level that they can handle. I will demonstrate that today on a patient who had liposuction, actually no, not liposuction, but injections, and some blunt cannula injections, along with a thermi-tight treatment that led to the paralysis, not paralysis, but paresis of the nerve. She is 1 week out, so it happened 1 week ago, and we're trying to expedite the recovery by using the stimulator. We will have our patient smile for us so we can document the amount of injury that we have at this time. As you can see, the weakness leads to lack of depressor labii inferioris working. If that muscle comes back, then she will have a normal smile. And the lack of activity in this depressor labii inferioris leads to the right depressor labii inferioris working a little extra, because it never pulls it down this much, but it's doing it extra. We can use a little Botox to calm it down, but in the time when you're so distressed with this situation, you don't want to complicate the issue by having the wrong dose of Botox go in and have a complete paralysis. But you should be aware that yes, that is an option available. And once we start doing this, and then once we get the activity back here, this muscle will start relaxing as well. May I have you smile, please? May I have you purse your lips, please? Perfect. These are perfect exercises to do, and the more you do, the better it is. So as you can see, we have our patient ready for the stimulation using the stim pod. Stim pod is the same stimulator that comes with thermi-tight and allows us to identify the marginal mandibular or other facial nerve branches. At this point, we have our stimulator ready, and we have it at 0.1 ms frequency. I'm sorry, that's the pulse width. The pulse width is 0.1 milliseconds. The frequency is 2 hertz, and they're very, very low. And the amplitude right now is 15 milliamps. and we try to identify the nerve starting at a very small level at 3 milliamps, and if we can't, then we will increase the frequency. We have the electrode in place, which is very important, close to it, and then we follow about 2 centimeters below the mandible border and start climbing up, trying to find the nerve. We can go up on the amplitude to 10. We are beginning to see a twitch in the muscle, if you can see in the chin area. We will increase the amplitude to get a meaningful twitch. Now we are up to 15 milliamplitudes. You can see a very clear twitch. That does two things. One, it confirms to us that the nerve is intact, which is very reassuring for the patient and for the doctor. And it also is exercising the muscle, which will allow a speedy recovery of the muscle as opposed to passive exercises. We are currently at 20 milliamps, which is the maximum stimulation amplitude possible with this device, and the patient is tolerating it pretty well. And we can see the movement in the left lower lip and the left chin. We are continuing to follow our patient with the marginal weakness. It's been 2 weeks and a few days, and the stimulator is definitely helping with improvement on the left side, which is the side with the weakness. But there's overcompensation on the right side by the depressor labii inferioris muscle. And we are going to try to even it out by taking away some of that hyper response. And I'll have the patient smile so you can see the vector of pull that I've marked. And along that vector line, I will be using only 2 units of Botox, which is a very small amount, but you don't need a lot, you need a very tiny amount in that area. Before we do our injection, it is imperative to get the exact dosage because you cannot mistake on the dosage. And we have our calendar here that we have done for dilution, and that is at 1 vial of Botox, which is 100 units diluted into 4 ml, and you can see the chart has it all broken down, so there's no chance for error. And you can see that 2.5 units is in 0.1 ml. If you want to use only 1 unit, that's 0.04 ml. So for the hemi-lip, we have 1 unit at 0.04 ml. It has been double checked to make sure, so we'll start only with 1 unit, which is 0.04 ml. The smallest dose possible in a way, and then in a week we can add another unit if we have to. Smile, please. Keep the smile there, please. Thank you. The injection has been done. As you can see, it's really quick and easy. And we expect to see the results in about 5 days. So we will evaluate our patient again in about 4 to 5 days to see any change. But we will not put any more Botox, not even 1 unit, for at least 1 week. because some people can have delayed response and you don't want to overdose, because then you cannot remove it. So we are being extremely conservative in this situation, and rightfully so. Hi, we are following our patient with the left marginal mandibular weakness, and we are at 3 weeks mark now. We injected the opposite side in the depressor labii inferioris with only 1 unit of Botox to achieve a little bit of symmetry. And now when we ask our patient to smile, it is slightly improved in terms of the asymmetry. Would you please give us a smile? We're showing, there you go. So we still have it, and we could make it even better by weakening this muscle with 1 more unit of Botox, but we have decided not to do so, because as the opposing muscle starts coming back, then we could have an asymmetry again. Since the Botox can last up to 4 months, we decided not to. And patient continues to do passive exercises and active. Active exercises are grimacing and making facial expressions, and passive are using the stimulating electrodes. And we'll continue to follow the progress as we go along. Hi, we are continuing to follow our patient who had developed the marginal mandibular weakness on the left side, and we instituted a protocol of using the nerve stimulator StimPod 3 times a day for 5 minutes each time, where right at the area where we have the facial artery, patient was able to locate and then stimulate the nerve. And the purpose has been to make sure that the left-sided muscles, the depressor anguli oris, the depressor labii inferioris, and the mentalis don't atrophy with time, and it's been maintaining the smile at a reasonable level. We also counteracted that with only 1 unit of Botox in the depressor labii on the other side, and that worked out very well to camouflage the deformity that you see with the nerve. And we'll record it now. It's been 5 weeks, so we want to see the progress as it happens. So as we look at our patient, we can see at rest the smile is very symmetric, and now I'm going to have our patient smile with the lips closed, and you can see you cannot tell that there's any deformity at all. This is a nice trick that actually I didn't even realize, but my patient came up with the idea of smiling with the lips closed, and it hides the deformity very well. Now we'll ask the patient to smile the real way that she does when she's really happy, and you can see the deformity now, where now still it is being not pulled down. The depressor labii should be pulling it down, and it's not. And it is getting better with time, and our patient has witnessed that just by the amount of mouth opening on this side that she notices. She can tell that it's improving. It's definitely not there, but we do see the progress, and that is very important, because at the 6 weeks mark is when usually majority of these return, which might not be a complete return at that point, but you can see it at least. And we are close to that mark at this time, and we will follow her again at 6 weeks mark, and then 8 weeks, and so on, to see when we have a complete recovery. But in the meantime, we'll continue with the stimulation and also with active exercises of the mouth as well. Would you be so kind to show us the exercises that you do when you are trying to exercise those muscles, please? Perfect. So thank you very much. So you can see that, it's the silliest faces that you can make, but unfortunately that's exactly what you need to do, and the more you do it, the more you're strengthening your muscles and helping with the recovery as well. And it is very helpful, but alone it cannot expedite the process as much as using the nerve stimulator, which really moves the muscles very well. We are continuing to follow our patient with a marginal mandibular weakness on the left side that happened 8 weeks ago. We have continued with active facial exercises along with passive exercise using a StimPod, which is a neurostimulator, and initially it had to be used at about 10 to 15 milliamps, and now finally even at 3 milliamps we can get stimulation, which is back to the baseline. And we will want to take a look and see the improvement on the smile at this time. Would you please smile for us? So you can see that we still have weakness on this side in the depressor labii inferioris. However, the smile is straight, which means that the depressor anguli oris DAO has completely recovered. Could you please grimace and make the chin for us? So you can see this is very smooth and regular and symmetric, which means mentalis has recovered as well. So the only two things that are still lacking behind in recovery are the platysma that attaches right here and right there the depressor labii inferioris. So it might take longer for that to recover, but it's on its way. Now we will try to stimulate using 3 milliamps, and we are using the standard 0.1 millisecond of the pulse width and the frequency of 2 hertz. Wonderful. So we are able to get it on 4 milliamps right now, and I'm dialing it down to 3 milliamps, actually down to 2, 3. So we can very clearly see the movement in all those 3 muscles, the DAO, the depressor labii inferioris, and the mentalis as well. Great. So at this point, I think we do not need to continue with the stimulation because we know the nerve is intact, it's functioning. It's just a matter of the muscle recovering, and that'll take us time with the active exercises. And we will continue to follow the progress on a monthly basis. So we continue our follow-up on our patient with the left marginal mandibular injury and weakness. We are at 3 months and 10 days mark, and she has made an excellent recovery. And at this point, there are no social concerns, because the hardest thing in the beginning is the social concerns with the twisted smile and how to manage day-to-day appearance in public and daily activities, and speech at times as well, and in rare cases even swallowing on that side. She has recovered very nicely, and we are going to ask her to smile so we can see. And you can see that now it's very symmetric, and that's exactly what we want to see. Could you please pucker your lips? And you can see that puckering is returned back to normal as well, because those two maneuvers really make a big difference in our social lives with daily activities. And this is at 3 months mark, which is very typical of return of the injury. And we were able to expedite it and get earlier recovery with use of the stimulation, nerve stimulation, which is very good adjunct, and also using the Botox on the contralateral side in the depressor labii inferioris gave a little bit of more symmetry that got her through those tough times when the symmetry is so gross that you really don't want to go out. And that was very helpful, and at this stage I think that has been absorbed by the body, so that effect is gone, probably not there as much, and we have excellent symmetry. So hopes that this will help other individuals go through recovery if they end up with a situation like this.